Matt Del Vecchio here, specializing in home care, elder care planning, and the senior living industry. Thank you for tuning in here on a Sunday. Did you know that almost 1 in 4 Canadians are caregivers? And almost all caregivers are unpaid, and they were most likely thrust into the role of caregiver with no formal training. It can be stressful, exhausting, and overwhelming, and adding to the challenge is that we have a silver tsunami happening. As we age, more care is required at home. However, it's putting an enormous strain on our healthcare system, as we just heard in my interview with Beryl Wiseman. In fact, the number of people waiting for home care through the CLSC has more than doubled in the last 4 years to over 20,000 people. That's right, more than 20,000 people in the province waiting to get home care. Some families are waiting it out. Some adult children and spouses are actually leaving their jobs to help out, and other families are choosing to go private. Well, to help guide us through these murky waters, I'd like to bring in Kirstin Bennett, Managing Director of Premier Home Care. Kirstin is also a certified professional consultant on aging. Kirstin, welcome to Life Unrehearsed.
Thanks, Matt, for having me back today.
Well, thank you for joining me again on Life Unrehearsed. Such valuable information that we want to get out to our listeners and their loved ones. As mentioned, the majority of Canadians want to age in place, age at home. And as our population ages, aging at home can be more challenging. And so what are some of those challenges about aging at home, Kirstin?
Okay, so really let's get right at it because the challenge is real. Ultimately, it's in creating a safe and healthy living environment. So the challenges are the need for modifications to the home, denial of the circumstances. There could be cognitive issues that blur abilities to understand the needs for support and assistance. There could be the challenge of expectations that family members can support the changing needs, or those are people there that are actually isolated and don't have anyone to advocate on their behalf. And ultimately, it's knowing about and getting the resources, whether it be through the public, through the community, or private resources, to make it possible, because it is possible with a support system in place.
I think you bring up a huge point about the support system in place, and there are a lot of vulnerable older adults who don't have that support system in place, and part of what we want to do today is make sure we're aware of some of these resources. We were talking prior with Beryl Wiseman, the difference between public and private home care. Some families actually do both, but it can get very confusing, Kirstin. So can you explain the difference between public home care and private home care?
Sure. So public home care is the CLSC sending their own caregivers to the home, once a day, once a week, up to 3-5 times a day for various services. Very task-oriented. It could be medication, bathing. There's different people who are usually going to be arriving to the home during the day because they have a lot of people to see, as you were saying. It's very demanding on the caregivers and sometimes quite impersonal for the person who's receiving the care. In private home care, you have the same caregivers typically, or a team of caregivers who knows the person and the routine, and it's just a much more personalized service. Of course, public is provided at no cost, where private is a paid service, albeit possible for tax credit if you work with an agency and get receipts.
Yeah, we'll talk a little bit more about those tax credits. And, the reality is there shouldn't have to be any private home care. There shouldn't have to be any private RPAs or residences. But unfortunately, with our aging population and a crumbling healthcare system, they're getting more and more in demand. But let's bring it back. Ideally, we want to be able to access CLSC services. In my world, I get constant demand for that, and it's very frustrating for many users trying to access the CLSC. So can you sort of shed some light as to what we need to do to access public CLSC home care services?
Sure, and I agree, Matt. It's super important because everybody does and should have a right to access to the public services that are provided. So the first step is to open a file, is to get a file actually opened at your CLSC so a social worker can come and do an assessment of the needs. There are a few ways, for this to happen. It can be a direct request from the family doctor. Sometimes people don't realize that. So your GP, if you are lucky enough to have one, can sometimes put that request in, and it's sometimes the fastest way without being an emergency. It can happen after hospital discharge, which is sometimes considered more urgent. The individual or the family member can also make this request through a centralized number like the guichet d'accès, point of access of their local CLSC. Or it can actually sometimes by calling 811 and speaking to the social services specialist there. In any way, though it is done, just expect some wait times and delays, but I will always say, please just don't give up.
Listening to Life Unrehearsed, Matt Delvecchio here, and I'm talking about aging at home, or as it's called, aging in place. Sometimes I'm with Kirstin Bennett. She's a certified professional consultant on aging and the managing director of Premier Home Care. We're going to talk a little bit more about private options, but there's something called Chèque Emploi as part of the CLSC Home Care program. Can you explain what Chèque Emploi is, Kirstin?
Sure. So we talked about a little bit before about the CLSC sending different caregivers to the home and at different times. And, for some people they don't like that. Okay. So sometimes it's also not super effective. So the alternative sometimes is the Chèque Emploi Service program, where the CLSC gives a certain amount of hours per week, typically based on an assessment by the CLSC social worker. And these are subsidized hours, so the family can use these hours to hire a private caregiver of their choice, or either directly, or they can use them with a home care company like Premier Home Care.
We knock the government at times, but this is a really good program called Chèque Emploi Service. It's not easy to get, but it makes sense. There's a major labor shortage in the healthcare system, and this is their workaround, and they'll assign hours that will be subsidized that you could hire your own caregiver. Very interesting. So now on the private side, real quick, Kirstin, why are people hiring private home care companies?
So I think, the most important thing to understand is when does the public support get put into place? So it takes time, and it's also based on priority. So if the public system is working well, and for some it does, then I would suggest that private care hours can be added to complement the CLSC visits. But the reality is, because there is such a high demand, that for many it is very complicated to get the necessary support. So longer wait times, or because the support needs don't fall within the capacity of what the local CLSC can offer, then hiring for home support via a private home care company can create a more consistent and stable care environment. I would say even consider it even temporarily as you wait for the public system to kick in. It could be used for short-term needs or as part of a collaborative care team. And also at hospitals, rehab centers, overnights, to increase, or even daytimes, to increase the quality of life while they're staying at those centers.
Right. Okay. Now, it makes a lot of sense. And there are some government tax credits for private home care. Again, the government throwing a few dollars that way as well to help compensate for the crumbling healthcare home care situation. You're listening to Life Unrehearsed. Matt Delvecchio here. As our population ages, families and their loved ones have to deal with some challenging decisions. Add this to a healthcare system that we've heard about all show long, that it's stretched to its limits. Some would even call it broken. So many questions as we age, and I really wish I had a roadmap to navigate these uncharted waters. I get that question all that time. Well, let's continue our conversation with Kirstin Bennett, who is a certified professional consultant on aging and the managing director of Premier Home Care. Kirstin provides support and guidance for families and their loved ones throughout the aging process and navigating their life transition. So, Kirstin, thanks for hanging on here. This is something that you and I, quite frankly, see a lot. It's navigating and asking the right questions, because the show is called Life Unrehearsed. Indeed, our lives are unrehearsed, and things happen. So let's start with bigger picture. What, in your definition, is elder care planning?
Well, you basically use those words very well, Matt. Navigation. So fundamentally, elder care planning covers the navigation of the broader network of public, community, and private health system and resources, professional services, products for older adults and their families. Elder care planning it also provides the opportunity, I would say, for people to consider their values, their wishes, and the actual circumstances to make the best possible choices either for now or for in the future.
Now, to expand on that a little bit, you sent me a list beforehand of 4 of the biggest needs that families talk to you about as their family members get older and perhaps in need of more assistance. So we're going to rattle them off really quick here, Kirstin,
Sure.
starting with that famous word, navigating.
So the navigation piece is it's really learning about and finding and assisting people in gaining access to resources available in the public healthcare system, the community organizations that exist that are actually really eager to help, and private services, either products or service specialists that are out there.
So next up after navigating is guiding.
So it begins with a conversation. Oftentimes families need to talk out what the primary and more urgent needs are, and then, the secondary needs as well. We work really on better understanding people's roles and ultimately also the importance of advocacy, I'd say.
Listening to Life Unrehearsed, Matt Delvecchio here with Kirstin Bennett. She's an elder care planning specialist, and we're going to continue. We've done navigating and guiding. Next up on the list, Kirstin, is planning.
Right. So this is basically around the concept of what to have in place, okay? And basically what we don't have in place. So what could go wrong, what's working, so I'm talking more like the legal and the financial preparedness. This includes power of attorneys, protective mandates, wills, and, often less discussed but equally important are medical directives. And as well, there's the concept of the advanced care planning choices, choice at home or, within an assisted living environment. So it's basically what it says, planning for that.
Important, essential conversations regarding the planning. And the last one is facilitating.
Yeah, so, ultimately we are facilitating in those conversations, right, that may be more difficult to have and making the sometimes taboo subjects matters more approachable. We provide sort of a safe space to discuss the facts, despite the emotional nature of it all, and ultimately to move that dial forward.
Talking with certified professional consultant on aging, Kirstin Bennett, here on Life Unrehearsed. Kirstin, you see a lot in your day-to-day workings with families. And let's face it, there is a lot of caregiver burnout. 1 in 4 Canadians are caregivers in one way or another. And it's a lot. Usually untrained, you're thrust into that role of caregiver, and it becomes a lot. And so you really need to help yourself first in order to help your loved ones. So you're a big advocate of that. Can you expand a little bit on that?
Sure. I am an advocate of helping yourself first, although it's very difficult. But I really want to start with, please do not ignore your own health. Consider your own health as a top priority, because really what happens if something happens to you, right? Also, super important to remember that and put into places that you need breaks. You need fresh air. You need good nutrition. You need to move in your day. So to get those breaks, it's okay to accept help from others and to engage respite services, whether it's through the public, private, or community resources. I'll also say that talking it out is really so worthwhile. You can do it through a professional organization, spiritual organization, support groups. People have gone through it. It's good to talk it out. And honestly, I really wanted to say to please recognize your efforts, despite sometimes the less than expected outcomes, because ultimately I see small wins as big wins. So I hope that people can see that too.
Yeah, it's a message that needs to be reiterated. The old oxygen mask in the airplane scenario, right? Take care of yourself first and look for those warning signs. Day to day, you're an elder care planning specialist with a lot of families, Kirstin. Any words of advice to families who may have aging parents?
I will always say to gather information, okay? Gather the information and understand what's out there. Tackle one change at a time. Keep the conversation going, okay? It's super important is to keep it going forward. Also including everyone in the decision-making process, even the people that you're trying to get help for, even if it's simply by providing choices.
Yeah, excellent recommendations. All right, Kirstin, we're already running out of time.
Mm.
I want to thank you for taking up your Sunday. Such valuable information both on the home care piece and elder care planning. If someone needs to reach you, Kirstin, where can they do that?
Well, thank you, Matt, really, for having me today. It's great. I think the easiest way is just to go to the premierhomecare.ca webpage. There's a form that you can fill out either for information. There's also a form for a free, no obligation assessment. Those are the best ways that come right to me, or simply give us a call. The number's there on the website at premierhomecare.ca, and because we're here to help.
All right, Kirstin, thank you so much.
My pleasure.
That's Kirstin Bennett, elder care planner, certified professional consultant on aging, and she's also the managing director of Premier Home Care, a wonderful boutique company offering personalized home care services.